I'm a director of the Chain of Hope Jamaica, and I'm also a member of the medical board of Chain of Hope. I have been here at Bustamante for the last 2 years. The whole purpose of Chain of Hope Jamaica is to create a sustainable cardiac program here at Bustamante Children's Hospital.
I got involved with the Chain of Hope, and it was almost out of insight into seeing the missions coming to Jamaica for many years, as I became chairman of the board in 2006. In terms of training our staff, we just have 2 young brilliant minds of professional coming back to Jamaica after Chain of Hope had given them training in UK.
I'm Cleopatra Patterson. I'm a doctor here at the Bustamante Children's Hospital. I am Jamaican. I did all my training here in Jamaica, except for the past 2 years or 2.5 years that I spent in London learning cardiac anesthesia and cardiac intensive care for both adults and children. And I do recognize that there's a need in Jamaica for my skills. That's why I have come back home. Cardiac disease is a big burden here. It is disabling many children and continues to disable even more per year.
I'm Nigel Parks, and my son is Stephen Parks, who is a heart patient. He suffered from a valve that affects his heart. He cannot walk for long, run for long. Whenever he runs, he gets tired, short of breath. He always loved to play football, and you know, with the heart problem, he won't get far. But now that he has mended, he can really achieve what he needs.
My name is Magdi Yacoub. I'm a heart surgeon and the president founder of the Chain of Hope. I personally have been coming to this island to help with establishing these services for over 40 years.
Professor Howard Spencer. My relationship with Professor Yacoub has gone back many years, and we developed quite a great relationship. He has been a wonderful mentor. Of course, our challenge was always the available resources, because cardiac surgery is and still is very expensive. Sir Magdi was always coming to our rescue. He brought other valves and left these valves with us. He will bring open heart surgery equipment such as the pump, oxygenators, and really this was a significant contribution to building the service in Jamaica.
I went in surgery at Friday at midday, and they put the mask over my face and put me to sleep and give me relaxer, so that I relax and don't feel anything. And then they open my chest and they cut the chest plate and fix the heart, and then they fix it up and then they stitch it up back together, and then I went into the ICU for a day, and I come out at Saturday out of the ICU, and I am looking to go home at Monday. They said that might be I go home on Monday morning, and I am really glad that the surgeon has fixed my heart for me, so I can play a lot better and don't get tired really easy again. And I'm really happy that they help us all.
Training local physicians, nurses, technicians, and administrators to have a sustainable service in the future. And now we are at a very critical stage in the development of this project, which aims at offering humanitarian services at the very highest level to children of Jamaica and hopefully to the Caribbean.
I'm very grateful for the Chain of Hope, from the people from Chain of Hope, and trust me, I'm really grateful that they came down here and gave my daughter this beautiful surgery, and I pray God blessing upon them. Thank you.
When Chain of Hope establishes a center here, then this will allow more of our patients, more of our children to have complex heart surgery.
There is now plans for building a dedicated heart center, and it needs massive collaboration between different groups of people who are stakeholders and partners. We should work together to achieve this wonderful objective.
I'm Patricia Allen. I'm referred to as Lady Allen. I'm patron for Chain of Hope Jamaica. From a nursing perspective, I'm thinking that we're going to need about 50 million. And the idea came to me that if we had a walkathon and ask Usain Bolt to be a part of it, we could get people out and we could make the money. I will be the person to contact Usain and get that part of it, but to the organization of a run, I know nothing about it. I won't be able to help you. We had over 16,000 persons out. It brought home to me the fact that as a people, when we unite, we can do great things. What was fascinating was seeing the different corporate groups, the different t-shirts, the design, but the aim was all save a heart, help Bustamante Hospital.
Well, today is to raise money for the Chain of Hope Foundation for bypass for the kids, heart bypass for the kids. For me, it was an honor when Lady Allen approached me to ask me to be a part of this, to help out. And it was fun. I came out today. It was a lot of fun. There were a lot of people. They really enjoyed it. So it was a good success. For me, initially, the message would be just thanks for all the support, and hopefully next year you guys will come out in even more and donate more, and just to continue to work hard and to try to help the kids, because it's for a good cause.
Hi, this is Shaggy, and we're here at the Bustamante Hospital for Children. I'd just like to say it is an honor to have Chain of Hope. You know, they do a lot of incredible work here with children, especially in the field of cardiac. Just the way they sit down and do these surgery on these little babies. I sit out here and see some of the mothers and what the mothers do and how they're all worried. I walk and I look at them and say, hey, you couldn't be in better hands. These guys are pros at it. I was privileged enough to sit in on one of the surgeries. I was amazed at how easy they make it look. And it's one of those situations that totally humbles you. On behalf of Chain of Hope, I give them my respect and salute. And Bustamante Hospital for Children, definitely the closest thing to my heart. So they're definitely a part of our family. Thanks.